The key difference between ECG gel and ultrasound gel lies in their primary function and composition, which are tailored for different medical procedures. ECG gel is designed to conduct electricity. Its main purpose is to create a clear path for the electrical signals from the heart to the electrodes of the electrocardiogram machine. This ensures accurate readings of the heart's electrical activity. To achieve this, ECG gel contains electrolytes such as sodium or potassium chloride, which are ions that carry an electrical charge. Ultrasound gel, on the other hand, is formulated to transmit sound waves. During an ultrasound, this gel eliminates the air between the transducer, probe, and the skin, allowing the sound waves to travel into the body and create a clear image. It is typically composed of water and propylene glycol and is designed to be thick and sticky to prevent it from dripping off the skin during the procedure. In short, ECG gel conducts electricity for monitoring heart signals. Ultrasound gel transmits sound waves for creating images of internal organs.